Getting a facelift is a major commitment, the time, expense, recovery, and more. But what if there was a mini facelift that could make you look 10 years younger in 1 hour? Dr. Eric Seeger, board certified dermatologist and cosmetic surgeon, is here to tell us all about the HourLift Mini Facelift. Welcome to Top Docs. I'm Maggie McKay. Welcome, Dr. Seeger. Would you please introduce yourself?
Yeah, hi, I'm Eric Seiger. I've been a dermatologist and cosmetic surgeon since 1990, and I've been doing these facelifts for the last 25 years, and I have the best job in the world.
Apparently. Now, why haven't we heard of them before this?
Yeah, I think Lifestyle Lift, about 5 years after I started doing them, started promoting them on television. So it became much more popular because they advertised a lot. They're not around anymore, but they made it okay for the average person to actually get a mini facelift.
Wow. Well, I'm sure some people hear this and they're maybe optimistically cautious because it sounds too good to be true. But you are here to tell us it is true and it does work, and you have 25 years to prove it. So, for starters, can you tell us more about the HourLift Mini Facelift and how it differs from traditional plastic surgery methods?
As a dermatologist, I've been doing skin cancer surgeries and scalp reductions and hair transplants for years. And so I'm used to cutting and moving skin. So my mini facelift or hour lift is actually a skin surgery. It's not plastic surgery. So plastic surgeons, when they do a facelift, they not only cut the skin, but they cut the muscles and they tighten and move the muscles around. And what happens when they do that is, number one, you have to be hospitalized. You have to go under general anesthesia. And general anesthesia, if there's any problems that are going to happen, the probability is it could happen because of the anesthesia. So I like to keep it safe. Mine is done in an office. So they cut the muscles and move it, which means that when they move those muscles, the patients that could actually look different. So when you see Kenny Rogers or Madonna, you look at them and you're like, well, I don't want to look like Joan Rivers. It's because their muscles are moved. My surgery is done in the office. It's a skin procedure. So I get patients really comfortable with Valium and some Demerol, so they're nice and goofied up, but I don't put you to sleep, so I keep it nice and safe. I also save the price of the surgical suite or the hospital cost, right? So I keep it much more affordable. And then we numb you up. The patients don't feel a thing. I cut. I separate, so I undermine the skin, and then I tighten the muscles with a special procedure that keeps the muscles tight for 5 to 10 years without moving them. I'm just tightening them the way that they were 10 years ago. I then cut the excess skin and then I sew up. And then what I do is, because I can't take care of the mid face with my procedure, I then fill the mid face usually with filler, which is like putting air in a tire and restoring the volume back to the face. So my patients look 10 years younger, look refreshed. They generally say they don't want to look 20 years old again. They just want to look how they feel. And that's what I get to deliver. And I get to enjoy watching patients just have tears in their eyes right after the procedure when I show them the mirror.
How rewarding. I'll take the 20 years off. I have no problem with that. So, how is it possible to achieve such impressive results in just 1 hour?
If you go to the hospital, you're in the waiting room for, an hour before you go in. Then you get ready for anesthesia, and the anesthesia takes a good 40 minutes for them to put you to sleep. And then cutting the muscles and moving the muscles, there's a lot of blood vessels, and they put drains in, and there's swelling and a 2-week recovery because of the drains. By me just cutting and tightening and then cutting the skin and sewing, we can easily do that in about an hour and a half. So it's amazing. hopefully patients get to see before and after pictures on this podcast.
Yeah, exactly. I hope so. So one of the standout features, you kind of touched on it already a little bit, but of the HourLift Mini Facelift is its affordability compared to other facelift options. Could you explain why the HourLift is more cost effective and how it benefits patients who may be seeking a facelift, but they have budgetary restraints?
So when I developed this in my mind, the reason I went into doing cosmetic surgery is because I used to see derm patients, skin diseases, and I would see like 80 patients in a day. And I started doing a lot of personal growth on myself. And I got to a place that empathy, compassion, making a difference became really important to me. And so I decided to do something, do this cosmetic surgery where I could actually spend a lot more time with patients and make a difference for them. And then when I started thinking about it, I decided I want to make a difference for people that usually couldn't even afford to get this done. So I created this in mind to do it on people that would never even have thought that it was possible for them, because that's who I wanted to connect with. So the cost is affordable because number one, there's no anesthesia cost, there's no hospital cost, there's no drain cost. It's just me working on a patient for an hour and a half. So I decided I wanted to reduce the amount that I was going to charge. And so people fly in from all over the country to have this done with me because they love the connection and the affordability that they have with me.
And what is recovery like time wise?
Most people in 3 days look good enough to go out to a restaurant. 80% of the people get no bruising, but you may bruise and you may swell. And if you do, it's about a week long. You get your stitches out in 1 week.
And with traditional, how long?
Usually a good 2 weeks. People are swollen with drains. Yeah.
Yikes. The drain part is like, ah. So with over
And I would put
6,000,
my results right up against any plastic surgeon's facelift.
I believe it. So you have what, 6,000 hour lift mini facelifts performed, and you
Well
have,
over 6,000 I performed, yes.
wow. And so you have extensive experience, obviously, in this field. Can you share some success stories or testimonials from your patients who have undergone the procedure?
Well, I have hundreds of pictures that I can share with you. And I'm sure if we go to the reviews, if you either go to Real Self reviews or Google reviews or my office's reviews, you'll see review after review, testimonial after testimonial. Yeah.
So besides the cost, what are some of the other common reasons patients choose the hour lift over other facelift options?
Well, the things that I hear are I look in the mirror and I'm starting to look like my mother. I hear that all the time. I look in the mirror and I'm seeing this Google or waddle or whatever turkey neck, and it reminds me of my mother, my grandmother, and I don't want that. I look in the mirror and I feel young inside, and when I look, it doesn't reflect me. I get that all the time. And yeah, and then there's a lot of people. I'm getting younger and younger people. It used to be my average patient used to be around 58, 62. Now it's like 52. So I have patients coming in that just want to keep their looks. They're using Zoom, they're using social media, and they look and see themselves and they're like, I'm starting to get these little jowls. My cheeks are starting to drop. I'm starting to get this here, and they come in early and I just, go like this to them, show them that. They're like, yes, that's exactly what I want. And they book and we take good care of them.
So does it take care of under eyes, or is that just a whole nother procedure?
So I do lower bluffs, I do upper bluffs. That's eyelid surgeries. But mostly, if I do filler on mid face, which is like a jelly, and we're putting air into a tire, which lasts a year to a year and a half, that takes care of under eye areas. And I get filler in my face every year. So
Really? Okay. I'm going to have to make an appointment with you. We did talk a little bit about the downtime and how it's quicker, but are there any specific post-procedure care instructions that patients need to know about to follow?
So we put ice on for 24 hours. They have a head garment that velcros on that just stays on for 24 hours. And then after that, they take a shower the next day. They usually take pain pills for 2 to 3 days. It's a little uncomfortable for the first couple days. Usually sleep the first day after they leave here because they've had their Demerol and Valium. And then I see them back a week later and take the stitches out. And generally, they're looking really good. Sometimes they're bruised, but most times not.
And are the stitches sort of on the side where you can't really see them by your
So
hairline?
my incision is in the hairline up here, comes down, it gets hidden in the ear here. And then if we just doing the face, we stop there. But if we're including the neck, I come around and it goes up into this area here. And then sometimes we add, if they have big necks, we do a little liposuction on the neck to give them a nice straight jawline and then give them their neck back. We have a lot of patients that come in for that.
Oh, okay. Oh, I didn't know that they did the neck. Liposuction, you always hear like the hips, et cetera. Okay. Learning a lot today, Dr. Seeger. Looking ahead to the next 10 years, how do you envision the future of non-surgical face rejuvenation procedures like the HourLift?
Yeah, I just got a new machine in 2 weeks ago that's pretty amazing that they developed at Harvard. And it's called Elocore. And what it does is it does surgery without scarring by making tiny little holes in the face. It's not laser. It makes little holes and sucks pieces of skin out that are tiny. And when you do it, it takes 5% of your skin out in each time you have it done. It's like thousands of little tiny plugs that get pulled out. And then when you heal, 5% of your skin is gone and everything closes down and tightens. And that's without scarring. So I just got that machine. I've done like 10 cases. It's really promising. And we'll see how that goes. So a combination of those two things, especially the skin around the mouth that gets all wrinkled in the ear, we take 5% out at a time, do 3 sessions, and that should do really well to tighten the skin around the mouth.
Is that going to reduce recovery time even more, you think?
No, that's usually like a week to 2 week recovery because you're doing little incisions where it's seen on your face. But within 2 weeks, it should be healed, and no one should notice.
So that's the latest. Is there anything else kind of in the air that they're working on?
I think that's the newest thing. There's lots of lasers out there. A lot of them don't do what they say they're going to do. And a lot of people spend a lot of money and don't get the results they're looking for. I bought a lot of machines over the years, and they're just sitting in my closet now.
Ugh, doesn't that kill you?
Yeah.
What about Fraxel?
People should be careful and really do their research.
Mhm.
Yeah.
How would you find out like which kind of laser surgery or procedure, I guess, would be best for you?
Problem is if someone just has one laser, they may try to promote that laser because that's what they have. So I guess I would say go to someone that has a lot of different options so that you can get to pick the option that's right for you.
That's a good idea. So, in closing, Dr. Seeger, is there anything else you'd like people who are considering the hour lift to know?
So the price of our lift starts at 3,900, but the average price is 6,500, and it depends on whether you do neck lipo with it, how much filler we do with it, whether we do your eyes, upper or lower eyelids with it, and compared to most plastic surgeons, that a facelift is generally starts at about 10 to 15,000 and can go as high as $120,000. No one needs cosmetic surgery, right? But if you look in the mirror and you're bothered and you go like this and you go, oh, that's what I want, then that's what our mini lift will do for you. And you come in and speak with me. It's consultation is no charge. You can come as many times as you want. We'll look in the mirror together. We'll see what's right for you together. We'll put a plan together, and someone brings you the day of surgery, and an hour and a half later, you're turned back the clock by 10 years. And again, that'll last for 5 to 10 years.
That's
And
amazing.
I have a lot of happy patients that come back and actually have it three. And I've actually had patients come back and have a fourth session because I've been doing this for 25 years.
Yeah. If someone would like to find out more or make an appointment with you, where would they go?
Well, I have offices in Michigan. I have 3 offices in Michigan. I also just opened an office in La Jolla, California by San Diego. They're 1 week a month. And you can just go to skinandvein.com and take a look on the website and find out where we are and come see me. You can give us a call. We'll even do a consultation over the phone or on a video chat.
That's great. Thank you so much for sharing this information and telling us about this exciting option. It sounds perfect.
It's been my pleasure.
Again, that's Dr. Eric Seeger. And if you found this podcast helpful, please share it on your social channels and check out our entire podcast library for topics of interest to you. This is Top Docs Podcast. I'm Maggie McKay. Thanks for listening.